Understanding kidney stones. Kidney stones. Hi. Kidney stones, also known as urinary calculi or lithiasis, from the Greek word lithos, meaning stone, are solid deposits composed of minerals and salts that form inside the kidney or ureter, the tube connecting the kidneys to the bladder. Kidney stones are a common cause of hospitalization in North America. It is estimated that about 10% of people on the continent experience kidney stones at least once in their lifetime, with the highest susceptibility occurring between the ages of 20 and 50. Statistics indicate that the prevalence of kidney stones is 3 times higher in men than in women. Moreover, individuals who have previously had kidney stones are at risk of recurrence. These stones can form anywhere along the urinary tract, from the kidneys to the bladder. Typically, they develop when urine becomes concentrated, leading to an increased mineral concentration in the kidneys, crystallizing and adhering into small particles that accumulate and solidify over time. Kidney stones can vary in size, with some being easily excreted in urine without causing pain, while others can reach several centimeters and cause significant pain as they move through the ureter, bladder, potentially damaging the urinary tract. Trapped kidney stones can cause obstruction, directly affecting the renal nerves and causing pain for the patient. In many cases, urinary tract obstruction leads to urine accumulation, causing inflammation. Kidney stones are one of the causes of kidney failure. Although kidney stones can be painful, they generally do not cause permanent damage if resolved promptly. Depending on the patient's condition, analgesics and increased water intake may be sufficient to eliminate kidney stones. Surgical intervention is only necessary in exceptional cases, such as when a kidney stone becomes lodged in the urinary tract, associated with a urinary infection, or leads to complications. Types of kidney stones. Identifying the type of kidney stones can help determine their cause and, of course, there may be various ways to reduce the risk of recurrent kidney stones. Collecting and providing urine samples for analysis to your doctor, especially after experiencing kidney stones, is crucial. Kidney stones are classified into 6 common types based on their composition: calcium stones, oxalate stones, phosphate stones, uric acid stones, struvite stones, and cystine stones. Each type has different causes of formation and treatments. 1. Calcium stones. Calcium stones are the most common type and often recur. The main cause is an overly saturated urine with calcium salts due to increased calcium absorption in the intestines or increased calcium reabsorption in the renal tubules, elevating the calcium concentration in the urine and increasing the risk of kidney stones. 2. Oxalate stones. This type is prevalent in tropical countries. Excessive oxalate in the urine can lead to kidney stones, with oxalates often combining with calcium to form calcium oxalate stones. 3. Phosphate stones. The most common type of phosphate stone is magnesium ammonium phosphate. These stones have a coral-like structure and typically form after urinary tract infections, especially with Proteus bacteria. 4. Uric acid stones. Uric acid stones are common in men. Increased uric acid concentration in the blood, along with deposits in cartilaginous tissues, mucus pouches, and muscle skin, can lead to increased uric acid concentration in the kidneys, a primary cause of uric acid stones. These stones are frequently observed in patients with gout, a result of nucleic acid metabolism disorders. 5. Struvite stones. Common in women with long-term urinary tract infections, struvite stones result from these chronic infections. They can grow rapidly, easily blocking the urinary tract without causing many symptoms or warnings. And 6. Cystine stones. Relatively rare, cystine stones are formed by cystine, which is less soluble and tends to deposit due to a congenital disorder affecting cystine reabsorption in renal tubules and intestinal mucosa. Symptoms. While kidney stones form in the kidneys and urinary system, they often cause minimal symptoms. Issues arise when the stones move within the kidneys or enter the ureter, leading to problems. If a stone becomes lodged in the ureter, it can block urine flow, causing kidney swelling and painful ureteral contractions. At this point, the following signs and symptoms may occur. Intense, stabbing pain in the lower back and sides, under the ribs, extending to the lower abdomen and groin. Renal cramps occur in waves and escalate into episodes lasting a few minutes, often occurring early in the morning or late at night when the patient is in a resting position. Pain or a burning sensation during urination, accompanied by frequency and urgency. When a stone is stuck in the ureter or bladder, the patient may feel the constant need to urinate, yet the urine output is minimal, leading to fatigue. Obstructed urine flow from kidney stones can result in kidney stasis and renal pain. When the stone moves from the ureter to the bladder or from the bladder to the urethra, there may be intense pain during urination. Bloody, pink, red, or brown urine, cloudy or foul-smelling urine. Blood in the urine is a common symptom of kidney stones due to stone friction during movement. The visibility of hematuria may vary, and microscopic observation may be necessary. Nausea and vomiting. Kidney stones can affect the digestive tract through nerve connections, causing nausea and vomiting. Fever and chills in the case of infection. Kidney stone disease can easily lead to urinary tract infections. If urine flow is blocked, the risk of infection increases rapidly, leading to severe conditions such as pyelonephritis. It is advisable to schedule a doctor's appointment or visit the hospital as soon as possible if intense pain in the lower abdomen, lower back, or testicles in men is experienced. Abdominal pain accompanied by nausea and vomiting is present. Abdominal pain with fever and chills is noted. Difficulty urinating or presence of blood in the urine is observed. Causes and risk factors. Kidney stones often do not have a single precise cause, but several factors can increase the risk of the condition. Dietary habits, excess body weight, certain medical conditions, and specific supplements and medications are among the numerous causes of kidney stones. During kidney stone formation, instead of releasing dissolved toxins in urine, substances accumulate and transform into stones in the kidneys. This hinders the body's ability to maintain water balance while eliminating harmful substances through urine. The size of the stones varies based on time, location, and sedimentation. Some specific causes and associated risks that can lead to kidney stones include 1. Family or personal history. If a family member has had kidney stones, there is an increased likelihood of developing them. This risk is particularly evident in conditions like cystinuria, a genetic disorder leading to excessive excretion of a specific amino acid through the kidneys. 2. Dehydration. Inadequate daily water intake raises the risk of kidney stones. Insufficient water consumption results in concentrated urine, leading to elevated concentrations of crystals in the urine. 3. Climate. People living in hot, dry climates who sweat excessively may urinate less frequently, increasing their susceptibility to kidney stones. 4. Dietary factors. A diet high in oxalate-rich foods, such as almonds, nuts, cashews, peanuts, berries, kiwis, purple grapes, okra, leeks, and chocolate, can contribute to kidney stones. Excessive consumption of animal protein, sodium, and sugar can also raise the risk. 5. Digestive diseases and surgery. Conditions such as Crohn's disease, inflammatory bowel disease, and gastric bypass surgery can alter the digestive process, affecting nutrient absorption and leading to kidney stone formation. 6. Obesity and weight loss surgery. Obesity is linked to a higher risk of kidney stones. Weight loss surgery can also increase this risk by altering the digestive process and nutrient absorption. 7. Other medical conditions. Certain medical conditions, such as renal tubular acidosis, cystinuria, hyperparathyroidism, and repeated urinary tract infections, can elevate the risk of kidney stones. 8. Medications and supplements. Some medications, such as diuretics, calcium-based antacids, and certain antibiotics, can increase the risk of kidney stones. High doses of vitamin D and other supplements can also contribute to stone formation. 9. Age and gender. While kidney stones can occur at any age, they are most common between the ages of 20 and 50. Men are more prone to kidney stones than women. Diagnosis. Diagnosing kidney stones typically involves a combination of medical history assessment, physical examination, and various diagnostic tests. Common methods for detecting and confirming the presence of kidney stones include: 1. Imaging tests. X-rays. Traditional X-rays can identify some kidney stones, particularly those composed of calcium. Computed tomography (CT) scan. CT scans provide detailed cross-sectional images of the kidneys and urinary tract, offering a more precise view of the size, location, and type of kidney stones. Ultrasound. This imaging technique uses sound waves to create images of the kidneys and bladder. It is particularly useful for identifying stones in pregnant women and can help evaluate kidney function. 2. Laboratory tests. Urinalysis. Analyzing a urine sample can reveal the presence of blood, crystals, and other substances that may indicate kidney stones. Stone analysis. If a patient passes a stone, it can be collected and analyzed to determine its composition, aiding in treatment and prevention strategies. Treatments. The appropriate treatment for kidney stones depends on various factors, including the size, type, and location of the stones, as well as the severity of symptoms. In many cases, small kidney stones may pass out of the body on their own with supportive measures. Treatment options include: 1. Pain management. Over-the-counter pain relievers. Non-prescription pain relievers such as ibuprofen, Advil, Motrin, or acetaminophen, Tylenol, can help alleviate pain. Prescription medications. In some cases, stronger pain medications may be prescribed to manage severe pain. 2. Home remedies. Hydration. Drinking plenty of water can help flush out small stones and prevent new ones from forming. Increasing fluid intake is particularly important for individuals with a history of kidney stones. Pain relief. Applying a heating pad to the affected area or taking warm baths can help alleviate pain and muscle spasms. 3. Medical therapy with alpha blockers. Medications like tamsulosin, Flomax, may be prescribed to relax the muscles in the ureter, facilitating the passage of small stones. 4. Procedures. Extracorporeal shock wave lithotripsy, ESWL. This non-invasive procedure uses shock waves to break large stones into smaller pieces, making it easier for them to pass through the urinary tract. Ureteroscopy. A thin tube with a camera is passed through the urethra and bladder to the ureter, allowing the urologist to visualize and remove or break up stones. Percutaneous nephrolithotomy, PCNL. In cases of large or complex stones, a surgical procedure may be performed to remove the stones through a small incision in the back. Prevention. Preventing the recurrence of kidney stones involves adopting lifestyle and dietary changes to reduce the risk factors associated with stone formation. Recommendations include: 1. Hydration. Should drink enough water. For people with kidney stones or at high risk of kidney stones, drink 2 to 3 liters of water per day. 2. Dietary changes. Limit oxalate-rich foods. Reduce consumption of foods high in oxalates, such as nuts, chocolate, beets, and tea. Control sodium intake. Lowering sodium intake can help prevent the formation of certain types of kidney stones. Moderate animal protein. Limiting the intake of animal proteins, such as meat, eggs, and fish, can reduce the risk of uric acid and calcium stones. Calcium intake. Ensure an adequate but not excessive intake of calcium through food sources. Calcium-rich foods like dairy products can actually help prevent certain types of kidney stones. 3. Medication. Depending on the underlying cause, medications may be prescribed to reduce the risk of stone formation. This may include medications that alter the acidity of urine, reduce calcium excretion, or manage other contributing factors. And 4. Regular monitoring. Individuals with a history of kidney stones should undergo regular follow-up with healthcare providers. Monitoring urine composition and other factors can help detect early signs of stone formation. Conclusion. Kidney stones are a common condition that can cause significant pain and discomfort. Understanding the risk factors, symptoms, and treatment options is crucial for managing and preventing kidney stones. Individuals experiencing symptoms suggestive of kidney stones should seek medical attention promptly to receive an accurate diagnosis and appropriate care. While some kidney stones may pass on their own with conservative measures, others may require medical intervention, especially if they are large or causing severe symptoms. In cases where surgical procedures are necessary, advances in medical technology have provided minimally invasive options that reduce recovery time and complications. Adopting lifestyle changes, maintaining hydration, and following dietary recommendations can play an important role in preventing kidney stone recurrence. Regular communication with healthcare providers is essential so that people with a history of kidney stones receive personalized guidance and monitoring. As with any medical condition, the information provided here is for general education and knowledge purposes. You should consult a healthcare professional for individualized advice and treatment based on your specific circumstances. Good healthy. Thank you. Goodbye and see you again.